Hello viewers, welcome to Health Profile. Today we are here at Sunshine Hospital. Dr. Rohan is with us, consultant gastroenterologist. Hello doctor.
Good morning, Andy. So my name is Dr. Rohan Reddy. I'm a consultant gastroenterologist and hepatologist here at Sunshine Hospital's Paradise.
Doctor, what is acidity actually?
So see, when it comes to acidity, a lot of patients have a different explanation of what they mean by acidity. So when a patient walks into us saying he has complaints of acidity, so our main job is to find out what exactly is he talking about. So is he because acidity means a lot of different things. Acidity may when a patient comes in, we ask them acidity if it is something like a heartburn, something which is related to a reflux of whatever they're eating, or is it something related to vomiting or a vomiting like sensation, or is it related to something like a pain in his stomach. So the first and foremost thing when it comes to acidity is to describe the complaints of the patients and what exactly is causing these things. So once we isolate what exactly is the patient talking about, then we take it further usually. When a patient is talking about acidity, he means that he has that severe pain in his chest, and sometimes the patients also complain about that reflux sensation is whenever we're eating some food, something which is related to something spicy food or a lot of masala food. A lot of times what happens when the patients have severe reflux of whatever food they are eating, it comes back into the chest and into the mouth. So this is what exactly the meaning of acidity is.
Okay, doctor, what causes acidity actually?
So what causes acidity is a very complex thing, because different patients mean different things when they say they are having acidity. So what causes the usual sensation of reflux or regurgitation that is seen in most of the patients, and also heartburn that is seen in most of the patients, is because the first thing is because of diet. A lot of patients have an irregular pattern of diet. They don't eat right kind of food. They skip meals too often, or they eat too spicy food or too fatty food. So this is one of the most common complaint why acidity comes. And the second most common thing is lifestyle that we generally have. Rapid gain weight and very sedentary lifestyle that we don't do anything, sitting on a desk, especially office going people sitting on a desk in one particular position for for a number of hours. So lifestyle is the second most common condition why acidity happens. And the third and some of the non-common causes why we see acidity in patients is because they have a defect in either the esophagus or in the stomach, or this causes a lot of acidity. And sometimes it can also be because of an infection in the stomach, that is the H. pylori infection, which can cause a significant amount of acidity in people. And after that, a lot of patients take different kinds of medications for some other reasons, say normal painkillers that we prescribe on a day-to-day basis, sometimes for bone pains or body pains, or all of these things can cause a significant amount of acidity. So to just shorten it up, main things that cause acidity is, first thing is lifestyle, and then comes some defects in our system, infections and other medications.
Doctor, what is heartburn and what is the difference between acidity and heartburn?
So see, when it comes to heartburn, a lot of patients think it is because of a heart related problem. So heartburn is different from a heart related problem, because heart related problems have a similar kind of a pain in the chest, but when it comes to heartburn, the intensity of pain is comparatively less when you compare it with a heart related thing or a heart attack. But you also have a little bit of that regurgitation sensation and a lot of acidic taste in your stomach. So if you're having pain in your chest without any acidity and with some kind of a breathlessness or sweating, sweating indicates it is related to the heart. When there is no breathlessness, when there is no sweating, and you have some acidic sensation in your mouth, and you have a reflux of food materials, then that is a classical heartburn.
So what type of foods can cause acidity?
So see, foods are one of the main things that cause acidity. So this is commonly seen in all age groups of patients. So most common precipitants of acidity is one is spicy food, and the second is a lot of masala added food. Next is oily food, then fried food. These are some of the most common causes of acidity. A lot of patients come to us with these kind of when they eat these kind of food, especially when they go out or some parties, they eat this kind of food, they come back the next day saying they have acidity. So these are these kinds of food have to be avoided. And the other less common kinds of food which causes acidity is people who drink a lot of tea, coffee, soft drinks, that is Coke, Pepsi, and all of these causes acidity, and also chocolates can cause acidity.
Is it acidity dangerous, doctor?
So not when you are having it for a short period of time, but some people have it for years together. So when these kind of acidity related things happen for years together, say 5, 10, 15 years, so what happens is it slowly starts to create a long standing damage in your food pipe. So these can be dangerous over a period of time. These can develop into something called as strictures in the food pipe, which means narrowing of the normal food pipe can happen. And over a period of time, if you are still neglecting these kind of symptoms, you're not going to a doctor because of these symptoms. So these can go over 10 or 15 years later. These can also become malignant, or what I mean by malignant is these things can develop into cancers, but these take 10 or 15 years. So if you are avoiding these kind of symptoms for that much amount of time, so yes, these can these can cause long term problems in patients.
Doctor, is acidity and gas trouble are same?
Acidity and gas trouble can mean the same thing, and they can also mean a different thing. When I say same and different things with the same sentence is, so when people come to us saying they have acidity, they mean different things. So, sometimes patients say acidity even when they have a bloated stomach, they think it is acidity. So when they come to us with something like a gas trouble, so they mean all of these regurgitation sensations or pain in the stomach, they all they say it as gas trouble, but depending upon what the patient exactly is feeling when they describe their symptoms when they come to us, they can mean different things. So some patients come to us saying they have gas trouble, but in fact they do have acidity, and some patients come to us saying acidity, but in fact they have some kind of a bloated stomach, which can be a different thing compared to acidity. So it is more of a layman's term that the general people use for different things. So it is up to the doctor to differentiate between acidity and gas trouble and what exactly the patient is meaning by that.
Doctor, how can I get immediate relief from acidity?
So immediate relief, usually we advise a lot of patients when they have these kind of symptoms to take normal home remedies for this. So the normal thing is drink cold milk or eat some curd. These are one of the most best ways to decrease acidity. If even with these things you're not having any relief of symptoms, then what you can do is you can take a lot of ENO is available wherever you go. So ENO is an antacid, as we say. So these have a definite help in curing your acidity. And even if it is not relieved by this, then you can take something like a sucralfate syrup, which are available over the counter in any medical shops.
So doctor, how do you treat acidity?
So see, when the patient comes to us with symptoms of these reflux disease or acidity, so the first thing is we ask what kind of lifestyle they are strictly following at home. If there is a problem in just the lifestyle of the patient, then we ask them to make some little bit of lifestyle adjustments. That is, eat right, eat short meals, more frequent number of times a day. Then physical activity, which is very important, especially in in our present generation, wherein the physical activity is usually avoided. We ask them to make these little bit of lifestyle changes, and if in fact even after these changes they continue to have these problems, only then we go ahead and start prescribing medications for them. So medications usually will solve the problem, but it's a temporary thing. So for a complete solution from these kind of problems, patients would need a healthy lifestyle choices. after which only medications can be a temporary measure. So even with these medications and lifestyle changes, patients not having any relief, only then we ask the patients to come back to us for investigations, wherein we do an endoscopy and to see what exactly is the problem. If they have a physical defect in their food pipe or the stomach, based on which medications have to be adjusted a little bit, changed, or something else to be added. So medications, treatment to acidity usually starts with physical activity and then goes with the different investigations.
So what is your take home message, doctor?
Take home message from me for acidity: if you're having acidity problem, look into your lifestyle choices, see if you're eating right, if you're skipping too much meals, the kind of food, the quality of food is also important. Correct your lifestyle, have a very good physical activity. If in fact you're not getting any relief even after this, then please do come back to us.
What is exactly brain tumor?
You see, tumor means uncontrolled cell growth. If that happens in the brain, it is called as brain tumor. So suppose I say you all have got hurt or injured yourself, but you see after some time, even without any intervention, you recover. So that happens because the cell divides and they form their own cells and you have the recovery. But if this cell division or multiplication happens without control, it forms a tumor. And depending upon the location, you can have, if it is in the brain, it is called as a brain tumor. If you have in the lung, then it is lung tumor or stomach. That is how it is. So this is simply, in simple terms, means a brain tumor.